Define meaningful use for the practicing cardiologist.
Well, it probably has many definitions as you look at it, but if we're specifically going to talk about the electronic health record and how meaningfully using electronic health records within our practice, and the reality is our physicians need to embed electronic health records in their practices and use them in a meaningful way, meaning that by putting this IT system and process in your office, we're actually going to provide better care for our patients. And hopefully by collecting that data and utilizing an electronic health record, we'll be able to affect patient outcomes in a much more aggressive and accurate way. So the bottom line is we can't just purchase a system and still continue to dictate or free text or handwrite. We need to make sure that we're embedding this patient data within the electronic health record so that we can actually extract it and utilize it for the patient's care.
Compare the rates of transitions between the hospital setting and smaller practices.
Well, I think this is where meaningful use becomes very complex for actually all of our healthcare providers, because there's really three different things going on. First, we have the hospitals trying to implement their electronic health records with meaningful use. And in most hospitals, that gets very complicated with what we call CPOE, or computerized physician order entry. So you've got to segregate it out. So we'll leave the hospital piece of meaningful use over here, and we'll concentrate just on the physician piece. In the physician world, the rate of transition into meaningful use is slow. And the smaller the groups, the slower it is. Because number one, many physicians can't afford an electronic health record. They have no clue where to start to choose one that can really be used for meaningful use for the patient. So what we've seen is the larger groups have probably already transitioned. For instance, our electronic health record has been in place for almost 7 years. So it's very dynamic, it's very robust. We use it for a lot of data. And meeting meaningful use was not terribly difficult for us, although it required a number of changes in our workflow. The smaller practices, just putting in an electronic health record doesn't solve the problem. You have to completely change how you see patients. And therefore, in the smaller practices, oftentimes the transition into an electronic health record and then that second transition to meaningfully using it is very difficult. But something that we all, and especially at the conference this week, we need to figure out how to get electronic records embedded in our offices and use them meaningfully.